Hello, I am Dr. Sreekanta Swamy, Senior Consultant in Neurology at Aster RV Hospital, JP Nagar, Bangalore. I am here to give you some information regarding migraine headache, and I will have to tell you about the clinical features so that you understand your headache better. The clinical features of migraine headaches can be different in these two types of migraine headache. That is, one is called migraine with aura, another type is called migraine without aura. So migraine without aura is a common type of migraine. It amounts to about 80% of the total migraines, whereas migraine with aura amounts to about 20% of the migraine. And people who have migraine headache, most of the time they don't even know that the type of headache they have is a migraine headache. And even the general doctors to whom they go for medication and treatment, they also, many people fail to recognize that it is a migraine type of headache, because it is important to recognize, because there are some specific medications that are available and we can prognosticate about the future course of the headache, and we can always assure the patient that this is something which is not dangerous. And it is important to know the clinical features. Most of the time, the common type of headache, migraine headache, that is migraine without aura, will manifest with a pulsatile headache. Most commonly, in about 50%, it will be on one side of the head, and it is like heart throbbing. And it starts in the milder form, then it gradually increases over next 2 to 3 hours, and usually it lasts for 3 to 4 hours. And when it reaches peak, it is usually severe type of headache. It is moderate to severe type of headache, whereas mild headache is not common in migraine headaches. And the people can have vomiting sensation, that is called nausea. Sometimes at the peak of headache they vomit, and which makes them better. They will have difficulty to look at the bright lights. They cannot tolerate the loud noises. And some people also will have warning before these headaches come, like 1 or 2 days before the headache starts. They may have mood changes, they have some craving for some particular type of food, and they will have sometimes swelling of their limbs, and their sleep may be disturbed, their thinking may be affected 1 or 2 days before this headache starts. If somebody is very clever to identify these, then they can expect that there is going to be a headache, and they can take some preventive measures also. Whereas migraine with aura is self-explanatory, wherein before the headache comes, there is some warning symptoms. Most commonly, the warning symptoms are flashes of light in front of the eyes, or numbness, or difficulty to think, or sometimes weakness also. These occur about 15 to 20 minutes before the actual headache starts. When the headache starts, these symptoms will disappear when the headache will start, which is going to increase in next 1 to 2 hours. And this sometimes can be very severe, wherein it can lead on to the blindness, weakness, etc. But as I mentioned, this is a less common type of migraine headache, whereas migraine with aura, without aura is common. So it is important to recognize this. So according to the Headache Society, they give a guideline how to diagnose migraine. Any headache which is usually hemicranial or one side of the head, which lasts anywhere from 3 to 4 hours, which is moderate to severe, may have difficulty to look at the light, tolerate the sound, may have nausea and vomiting sensation. It is easy to diagnose if this headache fits into this group. But it may not be all the time true. Sometimes headache can start in the neck, sometimes headache can be only in the front of the head. So these are atypical manifestations or presentations of migraine. So it is important to know whether you have a migraine headache so that you get a best treatment for that.